interesting information within the AWV fee scheduling pricing for your Welcome to Medicare. 2020 was $70.03, and 2021 only went up to $71.21. And the EKG that you can bill along with that, there was a decrease in that payment from $17.40 to a payable of $15.04. For your initial AWV, there was a decrease in that fee schedule from $74.45 to $70.85. But for your subsequent visits for AWV, there was an increase of from $118.35 to $134.74. So I encourage you to really look at those fee schedules, and because there were some procedures and coding that went up in price and some that did go down. So really take advantage of that link in the slides and look at those fee schedules to make sure that you are properly being reimbursed for your services. Next slide, please. So for the COVID vaccine key information, claims submitted for this must be directly sent to your Medicare administrative contractor or your Novitas with your MAC Novitas. Medicare payment rates for the administration of a single dose is being reimbursed around about $28.39. And for those vaccines that are multi-dose, the initial administration is $16.49, and the final dosing being $28.39. If you do have vaccines that are out there that have more than 2 dosings, you would only get payment for the initial and the final. These rates are based off of geographical adjustments, and I would strongly advise you to visit this hyperlink as well on the toolkits for COVID-19 vaccines for the health insurers and Medicare Advantage plans to ensure that you are billing these correctly as these start to be phased in to be administered to our patients. Next slide. So our telehealth expanded COVID-19 payer coverage dates, there was a lot of information for each of these payers. So we have provided a lot of hyperlinks here for you on good informational tools and tips and places to go. Lots of facts, question and answer sheets. There was just way too much information for us to try and provide in here for you, so we wanted to make sure you had the resources to go and review this information. But for Humana, for their expanded dates, they have expanded all of their cost share, copay and deductibles for COVID-related incidences through the full year of 2021. Aetna is still standing at January 31st of 2021. I'm not sure where they are planning to go with theirs, if they plan on extending and following suit with everyone else. We did verify this. As of this morning, they are still listed as January 31st. Cigna MA has extended through April 20th, along with United Healthcare. And Blue Cross Blue Shield is continuing to cover cost share waivers for testing only. Treatment is no longer covered under that waiver, and cost share does apply. So I would strongly suggest you visiting these sites as well, or if you have generalized questions that we can help you with, we'll be glad to try and assist you with those. So where to find critical updated information from Premier? We have several different avenues for this information where we are publishing this for you. You have access to critical updates, educational materials, our previous webinars, and much, much more. We have our newsletters that go out every month with lots of good information on them. We have email blasts that come from Engage. So if you have had changes in your information or you are not receiving these, please be sure and let us know via your PBE so that we can get your emails up to date so that you are getting these blasts from us and critical update memos, our newsletters, and those kinds of things. And our monthly webinars like this one that we're having today. We'll be having those every month along with some educational webinars that'll be coming up that we will be presenting throughout the year, and that schedule should be coming out soon for the PBEs to deliver those to you, and those will include disease-specific educations, coding and billing education, any other kind of information that people would like to see, documentation on our 360 platforms, those kinds of things. And we have our website, which we are in the process of doing a complete new website design with lots of new areas to help us provide forms and documents to our providers to access so that you can have access to all this information at your fingertips. So it's a new year, which means all new documentation for chronic conditions. With every new year, our patients' chronic conditions reset with CMS, and they all default back to their base risk scores in our 360 platform. That means that all risk scores are reopened and need to be recaptured. Everything needs to be redocumented, just like if they were a brand new baby and all their little limbs grew back. So we have to make sure that we are really taking advantage of these times that our patients are coming into our office and documenting everything. So we wanted to bring out a couple of key missed opportunities that we see every year. Those are artificial opening statuses, any of your ostomies, tracheostomies, colostomies, any of those, your opioid dependencies, sedative and hypnotic dependencies, transplant statuses, and amputations. Those are a lot of things that we just really don't think about as we go through our exams, and making sure that those are documented and billed out on the claim. Key part, bill it on the claim. If it does not get billed on the claim, it does not capture as a closed gap with CMS. You may have documented it, but if it doesn't go on that claim, it will not close out that gap. Okay. And we will transition over to Ms. Kathy Johnson.
Thank you so much, Kristen. Really appreciate that. Great information. So what I wanted to talk about was the quality and G-Pro updates, kind of looking, where it is, where it's going, and how is that going to affect you all. So right now for 2020, we have the 10 different quality measures, and we get a ranked sampling of each of those measures, and we submit that information through G-Pro. Next year, they're giving an option. You can continue to do the ranked sampling of the 10 quality measures, or there's this additional way that can be done. They're trying to move towards less reporting burden on the providers, which I think everybody would appreciate. And they're also going more towards outcome measures. So it's definitely going to be a challenge and something we'll have to work on and really come up with some good strategies for. But next year it's optional to have it through have the EMR data feed in. So we're going to plan on to continue to use through Weisman our G-Pro submission just as we are this year. So and as Kristen just mentioned, there were definitely some increases to using telehealth, expanded reasons that we could use that. What's coming up this next year, there are two different ways that we get paid out with MSSP. One is the shared savings, and one is the payment adjustment. And the payment adjustment could be positive or negative. So starting next year, they're going to be going up. You have to have 60 points out of those 10 measures. You have to get at least 60 points to avoid a negative payment adjustment, which comes into play 2 years later. The minimum savings to be qualified for shared savings is 30 points. So that's the distinction. It seems strange to have two different cutoff points, but it's for two different pieces of that puzzle. And then the following year, the shared savings cutoff points are going to be going up to 40 points. We've never had any trouble getting, it's been consistently over 80, so I don't anticipate a lot of trouble with that. I just wanted to make sure everybody is aware of it. One thing that did come out from COVID for the CAHPS scores, for the patient satisfaction survey scores, everybody's going to get full credit for those for this year. One of the things that it's moving towards next year will be including electronic prescribing for controlled substances. Right now it's a bonus, and it's going to be required next year, but that's already required in Texas. So we're good to go there. For this year, we're using the 2019 benchmarks for quality. So typically they're about 90%. There are some that are very specific. And for next year, because 2020 was such an unusual year, they wanted to use 2019 benchmarks again in 2021. And I think that's just to be a little bit more fair to all of us. As we move forward into 2022, they're going to start MVPs. And what that is MIPS value pathway. The goal of this is, right now, you know how everything is kind of segmented. We've got promoting interoperability and quality, and there are cost sections. They really want to try and meld everything together. So that's kind of the way they're going, and that's why it's going more towards outcome measures, decreased reporting burden. More of it will be coming from the electronic transfer HIEs. Other things that I wanted to point out, we did do some QA audits this year, and I'll have the results. I'll be looking at it as a group for the town halls, but it was a great opportunity for all of us, and I really encourage providers to look at those results and in the office staff. And if you say, gee whiz, I know we documented, or we got a colonoscopy for this patient, that shouldn't have been missed, and you find out that we're not looking in the right place, this is a great opportunity for you to communicate that to us. We're looking everywhere that we know to look, but we could be off base. So we'd love to be able to capture that any way we can. In addition, what I've got on there, I say claims measures continue related to the inpatient and readmissions. That's how CMS calculates how many admissions or unplanned admissions and how many readmissions within 30 days. They use claims data to get those. They will continue to be measured throughout. And then the last piece that I wanted to talk about was they are really starting to increase their focus on opioid use And so that screening has been added to the annual wellness visit forms. We did distribute the new ones for 2021. So really hope you're using those, and because it does address opioid use. It kind of calls it out. It makes it a little more obvious for everybody, so it's easier to document. And if you do have templates in your EMR that you use for your annual wellness visit, I highly encourage you to add something about opioid use. And I think that's it for me, Lexi.
Thank you so much, Crescent and Kathy. It looks like we have a few questions. If you do have a question, please put it in the chat and we will address that. We have a question, is administration fee included in this? Which I believe that's to Crescent.
And just to clarify, administration fee into this in what subject matter on that one? I'm not sure exactly what, are we talking about with the COVID vaccines?
I believe it was sent when you were on the codes for the 9921345.
Okay.
Dr. Jaswell, can you clarify?
Yes. Okay. Routinely for any injections, we do have an administration fee, which is ranging from $15 to $30. Besides the medicine or drug itself, and that is what we call as an administration fee. And state is going to give us all the vaccines free. So we were not sure. I know that you are telling us that just bill it to the Medicare, okay, $28 or whatever. But that $28 covers the vaccine or the drug, or does it cover the administration fee?
Okay. So Lexi, if you could please go back to the vaccine slide for me. So the administration of the dosing of the vaccine, these payments are for the administration. If you receive the vaccine itself from a government entity, you cannot bill for the vaccine medication itself because it was given to you for free. You cannot bill for the medication. If you paid for the medication, then you can bill for the medication. But if you did receive it from, one of the government entities and they gave it to you for free, you would not bill for the medication. You would just bill the administration code, and these prices are for the administration of the vaccine.
Thank you. Thank you for clarifying that. And will you send us those codes, the administration code, or is it a still same what we use for all other things?
I believe they have a specific one. I will look that up for you, Dr. Jaswell, and we will make sure that we update this slide, we publish it, so that it is on here as well.
Thank you again.
This is Dr. Podgorecki. I wanted to ask, when we document the chronic condition codes on our super bill, does that only have to be done in one calendar year, or does it have to be on each super bill, like ostomy, all that stuff that's chronic, only once in a year? Do we have to show it on the super bill, or should those codes be on each super bill during that year?
Those are captured one time per year. So if you address it in a visit with your patient tomorrow, and it is documented in that visit, that is the only time that you have to document it as for those status codes or your amputations or anything like that. Any other time that you would document it is just if you're making a change in their care or their medication.
Sure.
Thank you, Dr. Pod. We have another question. Just to clarify, with Blue Cross Blue Shield of Texas, telehealth expanded COVID-19 payer coverage dates. Is telemedicine still covered?
Yes, telemedicine is still covered. All of those services are still covered services. They just may not, they do not fall under the cost share waivers any longer. So the patients are responsible for paying their copays, deductibles, and cost share.
This is Dr. Pod again on dealing with telemedicine or office visits, the new billing system where we are doing it by time. Have we had any feedback from patients yet when they get their bill showing that we spent a half hour, but actually only 15 minutes with the patient? Have patients been upset with that knowledge that we are getting paid to do documentation and charts that might not be during the exact time we're with the patient?
I have not heard any. I don't know if any of the other providers that are on the call, if they have any comment to that. I don't know if it's still just too early in the year for them to have received anything back from their payers on it. Lexi, have you heard any feedback?
I have not heard any feedback, but that's a great question. We have Michelle from Timron. She says that she's had no complaints with E&M codes.
Yeah, I think it's something we need to watch, because when the bills show up at the patient's house, they're going to remember that Dr. Pod spent 15 minutes with them, and then they get a bill that shows I spent 40 minutes. You know, I just wonder if that's going to jolt them a little bit because of the new billing way.
Sure. That's something definitely that we will monitor, and it may be even something that we need to provide out to our patients in an explanation of some kind of outreach to our patients that those codes have changed to where the billing has changed.
I totally agree that up to now, I've not told my patients that we have a new system for billing, but there might be, you know, one or two lines we could say in advance that, you know, billing will be different. And now the way insurance or government pays includes for work that's not face-to-face during that day.
Sure.
I just expect that we'll get some feedback from certain patients that it looks like we're cheaters, in the sense that 15 minutes was the visit, but now we have a 30 or 45-minute bill, you know, depending on how intensive the chart is. But maybe some sort of line of introduction will let them know it's done differently now.
Right.
Yeah, that could spare some grief.
Yeah, great.
We may be able to, Lexi, come up with something that we can give our providers that may be at checkout that they can hand to the patient.
Yeah, definitely. I think that's a great point, Dr. Pod. We can work on some type of communication if you know, if providers want to use that.
Yeah. You know, it's interesting because you still get the odd patient when you do teleconferencing that wonders why we billing for something on the telephone when we never did it before. And it's not many anymore. When we first started, I had more calls on that, but now it's more settled. But I just imagine we'll have some comments made about the new billing system.
Yeah, that's a great point. Great point, Dr. Pod. Thank you very much. Are there any more questions for Crescent or Kathy in regards to coding or quality? Okay, great. Well, thank you very much for attending. Just as a reminder, we will send out the recording and the slides probably by either late this afternoon or tomorrow. So keep a lookout for those. Please let us know if you have any questions regarding, the new final rules and the changes, and we will do our best to help you.
Lexi, just one last thing. Does our offices have copies of the new 2021 annual wellness exam forms, the ones that include the opioid questions?
So those were sent out, but I will make sure to send one to your practice again. So if you haven't received it, we do have the updated forms,
Good.
and we will make sure that y'all get those.
Yeah, I just did some and it was the old forms, so I don't remember the questions. So I'm not sure Tammy has printed them out for us or anything yet. So if you could send another one to us, that would be good.
Of course, I will send
Good.
it on.
Thank you.
Thank you very much. I hope everyone has a great day.
Thank you, Lexi.
Thank you.